My name is Emily Covington. I'm an admissions counselor for the College of Continuing Studies for the University of Alabama Online. This is the live Q&A session for the Master of Science in Nursing with the Family Nurse Practitioner concentration and the Psychiatric Mental Health Nurse Practitioner concentrations. If you have any questions, feel free to go ahead and start tagging those into the chat as we go through and do these introductions so we can make sure to get to those questions and answer them for you. I'm going to go ahead and let our faculty and staff members that are here with us today go ahead and introduce themselves, and then we're going to do just a brief overview of the program, and then we will jump into answering questions from our participants. Vickie, if you want to go ahead and start with introductions.
Sure. I'm Vickie Samuel. I'm the coordinator of Graduate Student Services. I do the academic advising and all the recruitment and application process for the College of Nursing for the graduate program. And we have the two coordinators for our nurse practitioners with us today. So Dr. Martin, would you like to introduce yourself?
Sure. Hello, I'm Rebecca Martin. I am the Family Nurse Practitioner Coordinator, and welcome to our session today.
Hello, I'm Dr. Johnny Tice, and I am the Psychiatric Mental Health Nurse Practitioner Concentration Coordinator.
Right, and then if someone wants to just give a general overview of the program with just some basic information, just to give our participants a good idea of what the program entails.
Dr. Martin, would you like to start with the F&P?
Sure. We have the MSN students complete a core course, the core courses, and that includes the 3 Ps, which prepares them to enter the F&P courses. We have 4 semesters in that program, and that includes the Family Nurse Practitioner role and issues. In the spring and summer, we have the Family Nurse Practitioner 1, which has the population focus of adults. Along with that, we have the Family Nurse Practitioner 1 clinical. In the fall, the summer, we have, that's the summer program, the F&P 1 adult and clinical. In the fall, we have the F&P 2, which includes the OBGYN, or women's health, and pediatrics. That's a combination population focus. And in the spring, we have the Family Nurse Practitioner 3, which the population focuses across the lifespan. Each clinical course requires 180 direct patient care hours with a preceptor and a clinical site. That clinical site would correlate with the clinical courses. So, for example, in the Family Nurse Practitioner 2 semester, which is pediatrics and women's health OB/GYN, the pediatric portion would be in a pediatric clinic, not in a family practice. It could be in a family practice, rural or federally qualified clinic, but you would not want to have that in an internal medicine clinic. So we can help you with that process in the Family Nurse Practitioner program, and that's all we have in that program.
Hello, everyone. My name, once again, is Johnny Tice, and I am the coordinator for the Psych Nurse Practitioner concentration. And our program mirrors the Family Nurse Practitioner program, whereas Dr. Martin mentioned students who are entering the program with their bachelor's and do not previously have a master's degree. You'll take the foundational courses in addition to the 3 Ps, and then you'll actually start the Psychiatric Mental Health Concentration Focus courses in the spring of your respective year that you're starting. And very similar to the F&P program, you will start with your core course of roles and issues for the Psychiatric Mental Health Nurse Practitioner. So that course number is NUR 591. After that semester, you'll move into the summer where you have, to begin, your actually didactic and clinical companion courses, and you have those consecutively for 3 semesters. So once again, just like the F&P program, it will be 4 semesters of population-focused courses that you'll take. So in the summer of that first summer, you'll take NUR 593 and NUR 594. And those courses focus on the child and adolescent client with psychiatric mental health care needs, followed by in the fall, you'll have NUR 595 and NUR 596, which is the psychiatric mental health of the adult. So that's 18 years old through the lifespan. And then lastly, in your last semester, you will actually have the opportunity to see clients and patients in your clinical settings across the lifespan, so from birth until death. And those clinical experiences would also align with those specific patient populations. Once again, very similar to and just like the FNP program, in each of your clinical courses, you will have 180 population focus hours. So you have 180 hours that first summer with child and adolescents. So once again, that's birth into the age of 17. In that fall semester, 596 with the adults, you'll have 180 hours. And lastly, in that final semester, you'll have 180 hours. A little bit different, I think, than the FNP is that on the psych side, we do recommend and encourage therapy hours. So the majority of your clinical hours for the psych mental health nurse practitioner program will actually be with a prescriber. And that looks, what that is someone who actually prescribes medication. So that would be your psychiatrist, that could be a DO or an MD, or obviously your psychiatric mental health nurse practitioner. In years past, students obviously, or students have asked, if they are able to do those hours with, say, for instance, a family nurse practitioner. And to answer that question, that would not be appropriate because those individuals have not been didactically trained to treat that population. Whereas I do know myself that there are some practitioners who do practice in behavioral health or mental health settings. However, that would not be an appropriate preceptor for someone in the psych mental health nurse practitioner program. Additionally, out of those 540 hours, so 180 times 3 is 540. Out of those 540 hours, we do allow up to 100 hours of therapy. So that could be with someone who is not a prescriber. So what does that look like? That would be your licensed clinical social workers, licensed professional counselors, marriage and family counselors, psychologists. So anyone who is not a prescriber, but because of your role and what you are preparing to become, the majority of the work that you'll be doing will be psychopharmacology and medication management. So that is what we, the majority of your hours should be focused on. I think that may be all that I needed to say or had to say. And once again, mirroring what Dr. Martin mentioned, if there's any questions related to practice site or the appropriateness of an actual preceptor, always be sure to reach out to someone here at the college. Don't reach out to another classmate or, take information from secondhand, because that information may not be correct and that could always put you at a deficit. So we don't want that to happen. So in the event that there's any question on if an individual and their credentials are appropriate for your clinical experience, please reach out to someone here at the college and we can clarify or verify that information for you.
Perfect. Thank you so much for that overview and that information about clinical sites. We do have some new participants that just joined us recently, so I did want to just let everyone know you can go ahead and put your questions into the chat, and we will have our faculty and staff members answer those as we come across them. We do have a question in the chat box that Dr. Martin has already given us some information on, but I did want to give an opportunity for y'all to speak on that. Ashley wanted to know which states are acceptable for clinical settings, and then also wanted to know what kind of clinical settings are preferred. If either of you want to, just if you have anything you want to add or speak onto that.
Well, this is Dr. Martin. It may be quicker if I do answer that question as opposed to trying to type it out. You can find the states that we accept students from, and those same states are the acceptable clinical setting sites also. So I've linked that on the chat box. As far as clinical practice sites, that is directly related to the semester that you are in. So if you're in the first semester, then of the Family Nurse Practitioner 1, that's adult health. So you would have an adult health provider, either in an internal medicine clinic, a family practice, rural health clinic, federally qualified rural health clinic. The second semester is divided between pediatrics and women's health, which is OB and GYN. You could choose a pediatric practice or a family practice rural health clinic or a federally qualified rural health clinic that sees pediatric patients and performs their health maintenance checks or their and primary care on those patients. Also, this third semester is across the lifespan, so you would need a clinic that would allow you to see patients from birth to death, or the elderly, and that can be in the federally qualified rural health clinic or a primary care setting. Sometimes students choose an internal medicine clinic for their final semester as a specialty clinic, and you can have up to 40 hours in a specialty clinic and then complete the remainder of their program in a family medicine clinic or primary care practice. We do allow students that final semester to have a specialty clinic choice if they have completed the requirements for the program. Oftentimes students need additional hours in pediatrics or in women's health at the end of the program, so we ask that they choose a specialty site to add to those clinical hours. So I hope that helps answer that question. And the preceptors for the family nurse practitioner include medical doctors, doctors of osteopathy, nurse practitioners. That's family nurse practitioners. You can use a family nurse practitioner each semester. Women's health nurse practitioner for the women's health section, and that can be a midwife. You can have a pediatric nurse practitioner in the pediatric section. And then certainly if you choose a specialty clinical setting in the final semester, that will be according to what specialty you're in. So if you chose a dermatology specialty and your preceptor is a dermatologist or a nurse practitioner that specializes in dermatology, we look at all those clinical applications, and we get back with the student and let you know whether or not that's an appropriate site or not when we have questions like that.
Great, thank you, Dr. Martin, for that explanation. There also was a question that's kind of related to this that I wanted to address that was submitted in the prior to this session. Someone wanted to know, with military families, if they move out of the approved states during the program, will they be able to continue?
They can, as long as they're moving into a state that we accept from. It's not necessarily where they're licensed, it's where they reside and where they do their clinical. So if they're in North Carolina and they hold a compact license and they move to South Carolina, then that's fine because we accept for South Carolina. But it has to be into a state that we accept from, and that's because of state authorization rules with the boards of nursing.
All right, and again, participants, feel free to put your questions into the chat box if you all have anything. If not, I will continue to go through the questions that were submitted prior to the session. Prior to the session, someone submitted a question about, they wanted to know how the part-time route goes. How are the classes set up with that?
Courses are set up by modules in Blackboard. They're given a time frame to complete those modules. That way it's easy for students to kind of pick the time that works best for them, whether they do it on the weekends or they do it at night, do it in the day when they get off of a long shift. Because nurses work odd shifts sometimes, faculty have set these courses up to accommodate them. So they'll get, each course will be different with how many modules they do, but each module will contain different things: quizzes, discussion boards, papers, and they'll be given a time that those are done. The fall and spring semester are 14 weeks long, and the summer is 10 weeks long. So the summer courses are a little more challenging because there's a shorter semester, but faculty make it work. Students have made it work.
I like to chime in as well. I guess just a little bit related to the actual course is and how they fall in the plan of study for someone part-time. So for the actual courses that you'll take in the plan of study when you're part-time, what is really, I guess, kind of help or what is spread out is more of those prerequisite courses and those foundational courses. So those will be the ones, so for individuals who are traditional MSN students who do not already have a master's, and so they're like, for instance, informatics and population health and advanced pharmacology, and those like things like that, you take less of those and you spread those out. But the actual core courses, the like for instance, for my program, NUR 591, 593, 594, and moving forward, those courses are only offered in specific semesters, and they go sequentially. So once you start the core or the population specific courses for the Psych NP program, so say for instance you start in the upcoming spring, once you start moving, you move forward with those courses and you will take all of them how they are, which usually as far as the specific concentration courses, there are no more than 2 per semester. In that first semester you may have an additional course outside of the population specific course. So for instance, in the spring you may have 591 plus health policy and finance or research and evidence-based practice, but beyond that, it will be no more than 2 courses per semester, unless you are doing, say for instance, a thesis option. Also, you know, say for instance, you got started and you had to stop for some reason. That does happen. Students have done that, but you will have to be aware that because those courses are only offered once per year, you may be delayed up to a year before you're actually able to get back in that next sequence again. So say for instance, you start in the spring, you start NUR 591, you progress in the summer to NUR 593 and 594. That summer something happens or you decide you want to take a break. You know, you do have that option. Life happens. We understand that life happens. And therefore, as a graduate student, you have, and Ms. Samuel, you might have to actually answer this because I don't know exactly how many years, I forget, but you have X amount of years to complete a graduate program once you start. So you are essentially started, you moving forward, but don't feel like you are locked in and you cannot stop. If something happens, you're able to do that. But it is important to know that the way that the courses are offered, they're not all offered every semester. So in the event that you decide that you just also need to take an additional break and that the pace is just a little too much, that's understandable, but understanding that those courses are only offered as they are presented.
Thank you. And could you also speak a little bit on part-time versus full-time? Do students have the option to do either part-time or full-time with each program?
Yeah, part-time and full-time you can do this program anywhere between 5 semesters and 8 semesters. Now, depending on what semester you apply and whether you go full-time or part-time, it is a little easier to go from full-time to part-time just because the way our courses are offered. Sometimes it's a little difficult to go from full-time to from part-time to full-time. Again, like Dr. Tice said, that most of our courses are the concentration courses are only offered once a year. So that can kind of put a kink in revising plans of study. However, I will work with students the best I can to develop plans of study that fits their needs.
Thank you for that, Vickie. We do have another question in the chat box. LaDonna wants to know, when is the application deadline for admission for the dual FNP and Pmhnt program?
The next semester that we're accepting for is for summer right now, summer 22, and the deadline is December 1st. And the fall deadline will be March 1st.
All right, thank you so much. I'm going to go ahead and, since we don't have any additional questions in the chat, we'll go through and go back to answering some of those that were previously submitted. Someone would like to know, sorry, let me pick which one we have not already answered. It looks like we did have someone that was interested in that postmaster's certificate for the FNP programs. Is there any additional information that we might want to share about that program that we haven't already shared?
Yeah, so that program, because they already have a master's degree, depending on what that master's degree is on, at times they would have to complete the 3 Ps, which is advanced patho, advanced pharm, and physical assessment. Before they apply, I really do like them to send me their master's transcript so I can review them and do a gap analysis to make sure that they've had those courses. So they've had them, we check them to make sure that the content is the same. If they do not need them, then they come in and they can do this program in 4 semesters, starting with the roles and issues course that Dr. Martin and Dr. Tice had talked about, and then going into the 3 semesters of the clinical and didactic courses. Sorry, I had to cough. If they need the 3 Ps, we just work them into the plan of study this couple semesters prior to starting the clinical.
All right, and then we also did have a question submitted about scholarships. Are there any program-specific scholarships that students would need to know about?
The College of Nursing, we have donors that give scholarships every year. So we have several scholarships that students can apply for when they're admitted that we give. The College of Continuing Studies also has a scholarship, I believe. There are also, I always tell students to check with your boards of nursing. Alabama Board of Nursing gives a fellowship away every year that students can apply for. These are not very publicized, so sometimes you have to do a little digging at the board's website. And if anybody shares information with me to share with students about scholarships, from time to time, a faculty member said that they come across a scholarship that I should share with students, and I do that. Every year, sometimes this changes. A faculty member can write a grant. I haven't heard anything for this year, but we're always crossing our fingers. But I do share information as often as I get it.
All right, thank you so much, Vickie. We did also have a question. Someone wanted to know about board pass rates at the end of the program.
The FNP, we're still waiting for our board pass rate for the 2021 cohort, but the 2020 cohort, we had a 97% pass rate, and the 2020 cohort, we had a 100% pass rate in the FNP program.
Hello. So we are once again also waiting for the 2021, but for the year 2020, for the psych nurse practitioner, we had an average pass rate of about 88%.
All right, thank you all for that answer. Another question that was submitted prior to this session, a student wanted to know, she said she's graduating, he is graduating in December of 2022 and wanted to know what's the earliest session that they can apply. Can students go ahead and apply before they finish their previous program?
They can apply during the last semester of their program. So it would be for the semester prior to that, but they can apply during their last semester, and then acceptance would be contingent of completing their BSN.
All right, and I also had a question submitted about the blended program. They just wanted to know details on the classes and expectations for the blended program.
I'm sorry, repeat that?
Sorry, they just wanted to know more information about that blended program and how it works.
Okay, well, it's similar to how Dr. Martin, Dr. Ty said. They come in and they do their core courses, which are courses that all master's programs will take, and then they'll do their family courses, and then the very next semester after our last family clinical, they come in and do their psych. So the last 3 semesters, they're doing their psych clinical courses only. Now they can, I guess they can take their exam for the family after they complete clinical, but they can't practice until they complete the whole degree. And they get their MSN after completing the psych clinical courses.
All right, thank you so much. Another question that we had submitted prior was someone wanted to know what are the requirements for admission? Are there any prerequisites for enrollment?
There's no prerequisites that they have to have. They do have to have a BSN before starting the program. Their GPA, they have to have at least a 3.0 overall or the last 60 hours. Because this program is competitive, we don't do conditional admits for this one. But their 3.0, we'll look at it overall or last 60 hours. And as long as one of them is above a 3.0, they qualify to apply.
Okay, and are there any campus visits required for this program?
I'm sorry?
All right, are there any campus visits required for this program?
We are currently revising how students we're doing that. We're the clinical intensives are going to be done virtually, and beginning fall of 2022, they'll be required to come to campus for 2 days for orientation.
We have another question coming into the chat now. LaDonna wanted to know, when's the application deadline for the Postmaster Certificate FNP program? Is that different than the deadline we shared earlier?
Because the postgraduate, most of our applicants don't need the 3 Ps to apply, so we only accept once a year for that, and that's in the spring. So the next group that we're accepting for will be for spring 23, unless they need pharm, patho, or health assessment. And then they can apply for summer or fall.
All right, participants, do we have any more questions you all would like to put in the chat? Feel free to put those in if you have anything that you think of that you would like our faculty and staff to answer while they're here to answer you. Is there anything that you all can think of that we haven't covered that you think would be useful information for students to know?
The one thing I like to tell students when I'm talking to them before they get into the program is to start thinking about their clinical preceptors, where they would like to do them, the options. We start the process of completing paperwork about a semester and a half prior to the semester they start clinical, but our deadlines are very firm. So if they miss that deadline, it could delay them a year finding a preceptor. And sometimes it takes at least 6 weeks sometimes to do an agreement with the facility. So we don't want students to be delayed starting clinical because it would extend everything a year. So I always tell students to start thinking about that their first semester and start thinking about where they would like to do clinical, reaching out to facilities to get an idea of where they can, because we can do a contract early, we can't do them late.
All right, Dr. Martin, Dr. Tice, is there anything else that you think would be useful for students to know before we conclude?
Well, we're excited that they're considering our program, and we look forward to hearing from each of them, and roll tide.
I echo what Dr. Martin said. Looking forward, and thank you again.
And if anyone has any follow-up questions or think of something later on that they would like to ask, you can always reach out to one of us. Our information is on the slide in front of you, and then we will also be sending out a recording of this. We had a student that added something in the chat. Can we get the emails of those in charge of accepting clinicals?
I'm sorry, if she can maybe, when you say accepting clinicals, what exactly? Are you meaning like who would be the contact to? I'm sorry, help me out with that one.
Who's in charge of approving clinical sites?
Okay, so that would actually, I guess, be Dr. Martin and myself. And our emails, are you able to see it there at the bottom on this screen? So if you are a Psych NP student, you could reach out to me if there was a potential site that you were wanting to have evaluated. Additionally, there's an email address, and you may have to correct me if I'm wrong, Dr. Martin or Ms. Samuel. It's clinicals at, what is it, CCN Clinicals? That email
It's clinicals at ua.edu.
At ua.edu. You can email that email address to ask about, you can inquire if we have existing contracts with facilities or previous preceptors. But if there's some, a site that you feel like we may not have had an agreement with, or something you wanted to run by us, we would be happy to explore that for you. And once again, if you like the site, I'll be happy to look at it or look into it. And then Dr. Martin would be the contact for a site for the family NP program. And both of our emails, I think, are listed here.
And when you start the process of, we do have a list of facilities we have contracts with that we do share with students. Also, when you're reaching out to facilities about clinical, make sure that they understand that we are different than UAB or UAH. University of Alabama at Birmingham and University of Alabama in Huntsville are two different schools. There's different schools. They have their own processes, so we get confused with UAB quite a bit. So just make sure that you're checking for the right school.
I think that's a great point, Ms. Samuels. And a lot of students do make that assumption or think that, that a facility has a contract with UAB, but we are complete separate organizations. So yes, ma'am.
I do ask that, students remember that, first of all, you need to know the clinical site or clinical setting that you will need, as in family, pediatric, or OB, before you reach out to me, because I may not know. And I do know about clinical sites in the Tuscaloosa area and around in Alabama, but remember, some of you students are from out of state, and I will need to look into those sites myself. So to save time for you, it's best that you know the clinical site, what the patient population that you will be needing, and look at the clinical sites that are already approved and we have a contract with, to save you some time in reaching out to me, because I may not get back with you the same day. I certainly won't most often get back with you the same day, and I'm thinking Dr. Tice will not be able to do that either. And so for sake of time, do some legwork, try to find out all the information you can, and then we can help you facilitate maybe some practice site placement. We are willing to answer your emails, and we're happy to do that. But at the same time, I do recommend that you look at the site that you will need for that semester, so that you can start working on getting those clinical sites and preceptors.
All right, and we have had a participant request if we could you put your emails in the chat for them, just so that they can have that. It may be easier for them to get it that way.
And students can go on the, I'm sorry, I'm cutting out, the CCN website and find faculty information. You can access a lot of information there about the nurse practitioner program, about the requirements for clinical sites, and that saves you a lot of time.
All right, if everyone has had their questions answered.
I'm sorry, my computer, my audio is cutting out. Anyway, so if you will look at the CCN website, and hopefully that will answer some of your questions. But we're glad to answer questions as we can, and thank you.
Yes, thank everyone so much for attending. And again, if you do have additional questions, feel free to reach out to us. That's what we're here for. So I'll go ahead and conclude this event if no one else has anything else they want to add. And everybody have a great rest of their day, and roll tide.